Welcome back to Daytime. Now, more people are getting active. Spring is here. It's officially out there, so we're getting outside. We're doing sports. We're doing extreme sports, all that sort of thing. Each and every month, the Ottawa Paramedics joins us to talk about some first aid basics. And today we're talking about head and spinal injuries. We welcome back Rob and Sue to the show. Welcome. Good to see you.
Good morning.
Hello.
So in the Ottawa community, Rob, I guess we're getting out there, we're getting a little more active. Is this the time of year you start to see more of these injuries?
Yeah, with Ottawa's becoming a healthy city. More people are getting out, they're riding bikes, they're rollerblading, they're skateboarding, they're doing increasingly more dangerous recreational activities, one to get the rush and the other just to improve their health overall.
Mm-hmm. And when we talk about head and spinal injuries, it sounds like it's probably one of the most serious injuries possible?
Yeah, it is because it deals with the brain and the spine, and that's your control center for your whole body.
Okay.
Yeah.
So what's the first thing? Somebody and I guess what are the symptoms? How do you know somebody has either hurt their head or hurt their spine?
I'll do that one.
All right, Sue, over to you.
There's a bunch of different ones that you can have. You can have a loss of consciousness, you can have confusion, paralysis, numbness and tingling in any of your limbs. Nausea, vomiting. If you look at the neck, it could be obviously deformed. There could be bleeding from the head or neck, or just general pain in the area.
Now, sorry, go ahead.
No, go ahead.
I was going to say, do you check to see, like, if you're called to a scene where somebody's had an injury, is the first thing you check for is whether they have any damage to the head or spine, even if they look like they've broken a leg, basically?
Yeah, that's in our protocol. It's we call it ABCs, and then head-to-toe check. So we'll check for airway, breathing, circulation on any patient, and then the next step is to check for a spinal injury.
Mm-hmm. And Rob, as you mentioned, is definitely the control system of our body, so you have to know what you're doing if you suspect that injury.
Yeah, and the main thing, the primary thing is that we don't want you to move the person, and we're going to demonstrate when we would move you is only if you have difficulty breathing or your ABCs are being affected. So we'll get you to lie down, Melanie. And
You're the guinea pig
I'm
today,
playing
my
dumb
friend.
today.
Yeah.
Okay.
So you're going to lie down on your stomach, is that right?
Yep.
Okay.
So with
Let's
this,
get all up here.
we always stress as paramedics is the main thing that you want to do is call 911 and get us going.
Okay.
And the only time that you would move a spinal injury is if they have an affected airway. So they're not breathing, they may not have a pulse. So something you have to do, like, say, CPR on them.
All
so
right.
what we're going to do is we're going to do it's called a spinal roll. So Sue's going to take control of the head.
Now, where should my arms be? Should I be
Don't
you
be
just
flailing.
lie like you're unconscious.
Okay, all right.
Okay. So Derek, you're going to come here.
Okay.
Right beside me.
All right.
And you're going to put your hand right here.
Here?
And I'm going to put my hand here.
Okay.
And I'm going to grab onto Melanie's shoulders. All right.
All right. Now, am I grabbing on?
No, you're just going
pull?
to. You can grab actually right here as well with me.
All right.
And then we're going to.
Straighten her head first.
Okay. So you can see Sue's just aligning the head so when she rolls, she won't be out of alignment when we get her to the top.
Okay.
Okay. Your count.
Ready? 1, 2, 3.
Oh, wow. Sorry, I
back a bit.
suppose I shouldn't even say, oh, wow.
Ready?
Yes.
One.
1, 2, 3.
Okay, so this is a two-stage thing when we're doing the roll.
So you know the spine stays in neutral alignment all the time because it runs from the base of your neck down to your butt. So if that is moved at all, that can affect your breathing or any type of mechanical movement. So Christopher Reeve, he had an injury at the top of his neck.
Okay.
So he was immobilized completely, and it affected his breathing. So any injury from the base of the neck down can cause severe injury to the person and can affect them in a life-threatening way.
Now, Sue, is this something where, I mean, people are watching at home and they're wondering, okay, if we suspect and the paramedics haven't arrived yet, do they do this sort of thing or always wait for the paramedics?
No, the only time that you would ever have to move somebody like this if you're suspecting a spinal injury is if they're not breathing or they have some kind of airway compromise.
Okay.
So that way you're able to access their airway and straighten it up and see if they're breathing, and if not, start breathing for them.
But
Okay.
that took 3 people to move me. So what if you're all alone? What do you do?
Yeah, in a remote area,
Yeah.
that sort of thing.
Ideal situation, this is what we have. If you have to roll the person, you have to try to minimize the movement as best as possible. And that's what people face. They don't read the book. Patients don't ever read the book when they're doing this type of thing. So that's what you're going to have to deal with.
Okay.
All right.
So what's next, Sue? What do we do next with Melanie here?
Well, next, if you were on your own, you'd basically just monitor her, see what her symptoms are, if she has any of those signs that I mentioned earlier. Make
Okay.
sure she's breathing, make sure she's got a good pulse and her airway's open. And once we're there, then we'll take over. And we've got a bunch of equipment. We'd kind of put you in a big collar, buttress your head, put you on a big hard board, and strap you in, take you off to the hospital.
Now, is there a time limit involved when it comes to dealing with this before, the situation worsens?
Well, they say it's the golden hour for trauma. So if you're involved in a major motor vehicle collision, or you've had a major trauma to your body, they say within an hour they should get to a trauma center. So the Civic is Ottawa's trauma center.
Okay.
So all paramedics have to be trained on how to do this, and then you mentioned you're putting the collar on and everything. What's after that? Do you have a special board that you have to put them on and then take them to the hospital? How quickly can you transport them?
Pretty quickly. It doesn't take very much time. If we were rolling her, we'd actually roll her onto the board.
Okay.
And once we got her on the board, there's just a few straps that go over to secure her on it, and the collar would, of course, already be on before we rolled her. And they're actually pool noodles that are cut off to make sure her head's secure there with some tape, and we're ready to go.
Huh?
Good.
That easy.
And I'm very comfortable, by the way.
Are you?
So
Well, that's very important
job.
too. You want to make sure that the patient is comfortable. Thank you so much, guys, for coming on the show again. Really appreciate having you. You're going to be all right? You're
I'll
breathing.
be
You're breathing okay?
Thanks,
All right, don't
Derek.
go away. We'll be right back. We're going to be talking to Lynn from Algonquin College to talk about the floral design program. You all set for that?
I'm all set for that.
Excellent. We'll be
All
right back.
Thanks, guys.